Well, good morning and welcome. I am really thrilled to welcome everyone here today and to thank you for joining us. It's thrilling to be back in VEC in person for the first in-person event since the winter of 2020. And I'm so delighted to have people here in person, many without masks as I am, given the good state of COVID at Columbia and in New York. And I'm really happy to hear that many are also online joining us remotely. So as everyone here knows, we've come together to really recognize the second anniversary of the lockdown in New York City, exactly 2 years ago. A moment when so many things changed for all of us, personally, educationally, professionally, in terms of the work we were conducting every day, in terms of our families and our lives. And today we want to acknowledge what happened, to take a long moment to acknowledge this time frame and its impact, particularly on the profession of public health. The last 2 years, as we all know so well, has showcased so much of what is powerful, essential, and really critical for our present and our future about public health. It's also demonstrated many weaknesses, many shortcomings, the consequences of long-term disinvestment, and the precarity of the world if we don't invest and lead adequately and effectively. It's taught us a lot about our work and also about what we need as individuals to keep to the mission of public health. The supports we need, the resources, the community, the mutual learning, the exchange, not just for the mission, but it's taught us about the importance of all of that to the ability of us to meet our mission. So assembled today at the front of the room, joining me are 5 individuals who have been, like all of us, working at the intersections of public health and the pandemic. People who have experienced the pandemic from different vantage points. And we're here today to hear their observations and reflections on how they continued their work under the most challenging of circumstances. Their thoughts on what we can all learn from this experience as public health professionals, and what this experience tells us about what we need to accomplish for the future, and how we can particularly think more robustly about how we support each other, how we enable our collective mission, how we unite more effectively in communicating and in advocacy, and of course, in protecting the public's health. So let me begin with some brief, and I mean brief, introductions, because each of these people deserves a really lengthy introduction, but I know that we're eager to get to the conversation. And so I'm delighted to be joined today, seating at the table. Closest to me is Nishay Mishra, Assistant Professor in Epidemiology in the Center for Infection and Immunity. And next to him, to his left, is Annabelle Cole, an Officer of Research and Community Outreach and Research Translation Corps Project Coordinator at the Columbia Center for Children's Environmental Health. And next to Annabelle is Jessica Justman, Associate Professor in Medicine and Epidemiology and ICAP. And at the far end of the table, but always last but not least, is Terry McGovern, Chair of the Halbrin Department of Population and Family Health. And lastly, it's my honor to introduce our moderator for today's talk, Michael Joseph, Vice Dean of Education and Associate Professor of Epidemiology. Michael will moderate this conversation and bring in all of your questions and comments in the latter half. Most importantly, after the event, for those of you in the room today with us, I'm delighted to invite everyone here in person downstairs in the VEC lobby to have lunch together. And lunch is already served. Michael, would you like to start?
Thank you, Dean Freed, and it's really great to see everyone here in person. And for those who are watching virtually, greetings to all Mailman friends and family. We're going to get started right away. So 2 years ago, the World Health Organization declared COVID-19 was a pandemic. Since then, more than 6 million people around the world have died from this disease, and COVID-19 has really disrupted daily life in unprecedented ways. So to begin this discussion, panelists, if you had to sum up the last 2 years in either a sentence, an emotion, an emoji, or a hashtag, what would that be and why? Let's start at the far end. Terry?
Okay, I guess hashtag resilience, hashtag decency. Sure.
Yeah.
I said hashtag decency, hashtag resilience, hashtag pain. I think it's been a tremendously painful 2 years, a lot of loss. I also have seen, as we all have, the most incredible kind of empathetic human behavior imaginable, and the most incredible resiliency on the part of healthcare workers, affected families. So it's all three.
Great. Jessica?
Well, that's hard to top, Terry. That was really beautiful. I will say the word that comes to mind, I don't think there's an emoji for it, is unprecedented. Unprecedented tragedy, unprecedented need and understanding of the importance of public health, unprecedented levels of collaboration and collegiality and working together. So really across the board, something that certainly I and really, I'm going to say everybody else had not seen before.
Annabelle?
I would say hashtag caring, hashtag service, and resilience was one of mine as well. I think that this year has really brought forth the best and worst in us all. And in thinking about the team that I work with, it's just really highlighted the resilience of the team, how much we all care as public health servants about the communities that we work with, and the resilience of the communities that we work with, that many of them that are overburdened already with disparate health impacts, thinking about how they've been so resilient through this pandemic as well.
Nishay?
First of all, like the loss, including personal, professional, so many ways, and frustration last 2 years. But there was a hope. Hope one day I will be sitting in one auditorium without mask when people are vaccinated. So that's where we are.
And I would just throw in, even though Terry mentioned this, I would say hashtag empathy matters. Just speaking with our Dean of Students, she shared with me that in fall 2021, we had 405 active student cases who were seeking some sort of student support services. And many of those cases were because of the mental health challenges brought upon by the pandemic. So I really want to just thank our Dean of Students and Sarah Tooley, who spends so much time just individual counseling of our students and just demonstrating that empathy in a real and tangible way to our students. Next question, to set us up, if you take a look at what happened in New York, one of the very frustrating moments during the pandemic that played out right before our eyes was a significant tension, right, and rivalry between the governor and the mayor, both wanting to show who had more power. And this rivalry and reluctance to work together really slowed the public health response on numerous occasions. We've heard the sayings when it comes to working as a team, two heads are better than one. There is no I in team. Teamwork makes the dream work. So panelists, highlighting some of your own COVID-19 work that you've been engaged in, or that coming out of your department or unit, what has this pandemic taught you about teamwork and collaboration? Let's start with Jessica.
I will reflect back on both some of the work I did in designing a clinical trial and also a COVID epidemiologic survey. And really, I should say that we did as a group, because it absolutely required collaboration across multiple parts of the school and with others outside of the school in order to put those protocols together, to design them and to get them approved really at a breakneck pace, at a pace I had never seen before for designing research, with just tremendous helpfulness from our IRB and our colleagues who manage grants and who work in SPA. I mean, everybody had this sense of we have to get these projects through quickly, and we're all pulling together. I mean, with any project, there's always little bits of some disagreements, but I really felt like this was, as I said, this kind of teamwork and people understanding that this was the time to really focus on getting new COVID research accomplished.
Annabelle?
Our center works primarily with the community. So I think that the fact that we all had to sort of come together and really quickly be able to become a resource and a safety net for the community that we work with. We work primarily with Dominican and Black women, Hispanic women, the Northern Manhattan community, Bronx, and communities that are considered to be disadvantaged. To think about our community and to think about our work from a different, we're failing all around, to be able to not just care about continuing the science and the research, because how do you call somebody and ask them about their asthma when they've just lost a family member? How do you call somebody and tell them, what are your exposures when they've just lost their jobs? And so our research workers really had to become, in order to be trusted, a safety net for them. So we were doing the work, continuing the important work of the science that we're trying to do. But at the same time, we were kind of thrust without preparation into a position where we were support services, where we were the safety net, where we were sending referrals for mental health. Meanwhile, many of us working from home, dealing with our own children going to school from home and remotely, and our own sick parents and our own family issues. So I think that teamwork was essential. I don't think we could have made it through this pandemic without being able to rely on each other, without being able to really connect with each other about the things that we were experiencing as a team, and being able to support each other. So.
Nishay.
Actually, for us, this whole thing started before it was announced as a pandemic or something. We started working very early on this disease in January itself. Dr. Lipkin visited to China, and I was in contact with him. Like I was working night shift when he was there, day in the lab also. And for us, it was very moving target. As the disease was progressing, our project was also progressing. We started with affordable testing, which in February 2020, we established the test, and March 2020, we got the FDA UA. Many people reached out to us to license that test. But that time, suddenly it became more commercial thing. How you're gonna make more money? Ultimately, we found the right partner who was planning to deliver the test to the right people with a very minimum cost, and we licensed with them. So far, they have used more than 15 million tests on those. school children mostly, and I'm sure those school kids in somewhere, they are not very happy with me and with my team because they had to keep going to school because of regular testing. Um, and the whole thing, like getting the support from the leadership, from especially the director, and like what you want to do and how we're gonna proceed it, not only the center, outside also, like from Dean, from Charlie, they all are sitting here, many other people, the technical staff, like who signed up to work for like 35 hours a week. And they were like working in the evenings, weekends, and all the time when everything was locked down. Same time when like other labs were like planning how we're gonna close it down, how we're gonna move the work to home. We were like discussing who will come to work every day, how we're gonna ramp up the more production, how we can take things to the people. So those all things we have been working throughout those 2 years, and somehow we are successful, not only with the people who are working in the lab, who are designing the experiment, or me, or like director, the other people also, like the shipment, and like people who are getting delivery for the reagents and everything, because that time was so difficult. But we had the team member who used to follow up the UPS truck for like 2 hours to get the material as soon as possible. So I think all the hard work and teamwork has been paid off. And from this podium, I want to thank again all the people who have been working with me throughout those 2 years, especially like Annabelle said, when people were like sick or their family were sick, they were still trying to deliver whatever they could. And it was very amazing experience. In 2 years, I have learned a lot, which I never thought about being biological scientist. Emotional well-being is a very, very important thing for being productive and for making it like happier work environment. So.
Thank you, Nisha. And Terry.
Yes, thank you. So I think we have a number of faculty who run clinics. So very early on, we were collaborating to try to get iPads and just basic equipment. One of those faculty, Dr. Catalozzi, along with Steph Grillo, Professor Grillo, were instrumental in creating the COVID-19 Student Service Corps. And I'm very proud to say that I saw many of our faculty and staff at the Armory volunteering night after night, volunteering to go out into the communities. Our students were all over the place. So I think teamwork was essential. I want to raise another aspect of teamwork, which is many of our faculty were participating in things like litigation around the use of public health to expel people from the country, turn people back at the border, the use of COVID to close down access to gender-based violence services or sexual and reproductive health services. So the teamwork went in many different directions. So it was quite something.
Yeah, this is great. And one of the things that we pride ourselves, especially with our MPH core, is teaching our students on how to work effectively in interdisciplinary teams. You know, we know that the best public health is done when it's not in our own silos, but working collaboratively and professionally with those outside of public health. So thank you for your insight there. Next question. You know, unfortunately, you know, we're living in an era where there's a blatant denial, blatant disrespect, blatant disregard for the value of public health and of science. How do you think, panelists, we can boost society's confidence in public health guidance, especially when that guidance is frequently changing? Let's start with Annabelle.
So I think that the number one thing, there's this widespread mistrust, right, of public health. And public health isn't in your face. It's not like, you know, I get heart surgery and, you know, you see the result immediately. It's not like, you know, it's not as tangible. It is in our face in everything that we do. The fact that we're sitting here, the fact that we have clean water, but it's not as visible or tangible to our communities. And so when we're talking about mistrust, I think that the number one thing is to really listen, right? And to do so in a way that respects the different viewpoints and the different experiences, the valid experiences of different communities. It's easy to say, well, that doesn't make sense. And you're like, you just, hello, it's science. Like, don't you get it? I think that's easy for us as public health professionals to say, but I think that it's important to hear, to identify voices and elevate the voices that people trust in their communities, to listen and have a healthy exchange of ideas. And I think that respect and listening to what our communities, what the issues are, is important. For example, when we're thinking about talking with communities, identify the leaders. That could be community health workers. That could be the youth in the schools. It could be we're elevating and teaching them and creating trust and creating expertise in people that they will listen to, community health workers, promotores, using tools like the arts and music to teach, so that and I was recently, this is in my mind because I recently went to an event where they were talking about using those tools as health promotion tools. So we have to find creative ways to really get public health information out there. With that said, I think it's become very politicized, right? And it's this idea of the individual rights versus the government trying to tell me, to mandate public health and population health. And so we really just have to be strategic, and we have to, it's a balance of knowledge and politics, right? Having this respectful interchange so that we can move forward, hopefully.
Thank you. Jessica?
Thanks. Just to build on Annabelle, what you were commenting on, the word persistence came to mind. I think that we have to just persist in our messaging and to convey to either the individual who's immediately in front of us that we're having a conversation with, or a broader audience, that the nature of science means that as we learn more, things will change. That change is part of the process, and not to be surprised when recommendations shift. And I think, in retrospect, going back 2 years ago, if some public health leaders, if we had been able to get everybody ready for that, I think we would have been in a better position, at least for some people. Nothing is going to be perfect for everybody, but I think, we could potentially have anticipated that as we learned more, things were going to change. I think I completely agree with the importance of listening. Again, whether you're talking to one individual who's very hesitant and doesn't trust the science and really trying to respect what their concerns are, or talking to a wider group, that just can't be underestimated. And the other point I will say, just going back to my description before, of the breakneck pace of putting together protocols and studies, what I should have added is that quality did not suffer. I was extremely impressed. I have a research site that was helping to do one of the COVID vaccine trials that was part of Operation Warp Speed. And the staffing on that from the clinical research organizations was phenomenal. And, every I had to be dotted, every T had to be crossed. And when I talk to people who are concerned that these vaccines were developed so quickly, I will try and point out that it was done quickly in part because the staffing level was brought up. And I know from, my understanding is at FDA, they brought up the staffing as well, and people were working nights and weekends. And to say, yes, I know it seems worrisome that things were done so quickly, but it's because of the tremendous hard work and collaboration. So.
Thank you so much. Nisha?
When we talk about public health to everyone, we try to educate them, not convince them. Like at the very basic, like when we try to convince, like we might try to over convince people, and then they may think you have your own benefit on those things. And it's unprecedented. Like we start talking about that. There's no other reference point for any pandemic. And this education should be continued for everyday learnings. We cannot ask like switch on and off. Okay, tomorrow we're going to teach you about like the vaccine. And we need to come up to that point what Annabelle said. We need to listen, we need to discuss, because nobody want to put their life on risk, for sure. People are trying to take vaccine or not trying to take vaccine. They all have some kind of idea. We need to create some kind of break that idea why they are not willing to participate. There has to be reason behind it. We need to find the reason. There's some political reason. I don't want to get into that. We all know about it, how it could be very difficult. And there has to be some educational program from the school level where we talk about COVID-19 in each and every school, like at least one lecture or two lectures in a year. So when these kids grow up, they have this kind of thought, what happened in 2020, 2021, because we all have very short memory. So we don't want to forget this thing, what we have learned right now.
And Terry.
I just want to go back to the politicization point and how confusing it all was for the general public when you think back to the Trump administration and the fighting about mask mandates and how Dr. Fauci was put in a strange position often. You can kind of understand why people were confused. Then you layer that on top of that, the history of structural racism and how suspicious many of the most affected populations are of public health. I do think the answer has to be in thinking about how we communicate, thinking about listening, but also thinking a lot more about the politicization issues and how we can deal with them. Because whether it's the mayor fighting with the governor or the president putting pressure, these situations had a huge impact on the public's perception. So I think it's always been important in public health to say we're not political in a sense, but it is now political. So I think we have to get a bit more sophisticated in our thinking about how we manage that.
Yeah, I agree, Terry, and I really appreciate the viewpoints that have been shared on this. The personal work that I engage in centers mostly on HIV/AIDS among heterosexual Black men. And we found that partnering with barbershops, in the community, the barbers are a respected and trusted source of information in the Black community. So partnering with barbershops really made a difference to some of the HIV/AIDS interventions that we were able to develop to kind of mitigate heterosexual transmission of HIV. So thank you. Going back to you, Terry, we know COVID-19 caused lots of disruptions, and as chairperson of a very lively department, Population and Family Health, I'm sure there were shifts in the types of research that were being conducted in your department. Can you elaborate on that?
Unfortunately, for a lot of our work, the pandemic was kind of used as another reason to kind of further oppress people. And I would say that in terms of forced migration, all the kind of stuff around the border, not letting people in. We also saw around sexual and reproductive health services, gender-based violence services all around the world really being shut down as essential services. And there was a huge need for advocacy to make sure those services stayed open. This issue of what is essential is another really complex issue that allows for all kinds of kind of biases to come into play. So I think we ended up having to do a lot of work, both documenting and pushing and advocating to do no further harm in the pandemic and to keep essential services open. I think it fundamentally, profoundly changed the way we do everything. And again, in the context of our work, sexual reproductive health, migration, COVID kind of just layered on another set of excuses to not provide, kind of services that reflect health as a human right.
Thank you, Terry. My next question is for Jessica. So Jessica, in your role and the work that you do as an epidemiologist, you're often interacting with folks in the media. So during these past 2 years of the pandemic, what was it like interacting with the media? And do you have any lessons learned on how to communicate important public health topics with the media and other members of the community?
Sure. Thank you very much for that. I do have some lessons learned, but it doesn't mean that I have totally learned them myself. I'm always striving to continue to reach for these objectives. But I think what I've learned is that reporters like to hear something that's very simple, very clear, and ideally very colorful. Anything I say that is at all, scientific or filled with jargon, they never pick that up. If I say something about, a metaphor of, it's raining and you have to keep your umbrella up, they love those kinds of sound bites. So I think, ideally, when you're going to be talking to the media, if I can think ahead of time, what are my key messages? Do I have any good metaphors to use? I learned to ask what web pages they were looking at, what data they were looking at, so that I could be sure I was going to be helping them to understand exactly what they were seeing. That, really worked well. And I think, going back also to, our earlier topic about mistrust, I just think that all kinds of ways of communication just help chip away little by little at layers of the mistrust. And that was really the way I was looking at it. And I think it's an opportunity for us as a School of Public Health to think about teaching our students, our MPH students, our master's students, how to do public health communication. I think that is, now more than ever, a really important skill and important part of being a public health practitioner.
Yeah, I agree wholeheartedly, Jessica. I think, our students and even researchers, we do such great work, but if we're unable to communicate that work in a way that's compelling and relatable and understandable, not only to a sophisticated audience, but more importantly to a lay audience, then that work is meaningless, to be honest with you. So we have to do a better job, teaching our students how do you communicate your findings in a meaningful way. And I think we also need to maybe think about ways in which we could train journalists and news media. And, I've cringed so many times just listening to the news and hearing, just how they would butcher a study and really don't have a full grasp of the epidemiology and the biostatistics and the research methods. And, so I think that it might be prudent for us to think about ways in which we can potentially maybe partner with the School of Journalism and develop maybe courses or certificates that could really target those in the media and the journalists and teach them, how to do good science and communicate findings in a way that's going to be just relatable to the layperson. So thank you for that. Appreciate that. Nishay.
Yes.
So early in the pandemic, through your work as a virologist and molecular biologist, you were among the few who were coming to work every day. The pandemic has forced companies and organizations and even us at the Columbia Mailman School, we're thinking about, our new work environment. So can you comment on work from home policies and its influence on power dynamics between employer and employee?
Tough question. So if you asked me the same question 2 years ago, I would have different answer. But now I think we are used to with this whole hybrid system, like today's talk also in hybrid way. We are learning in that way how we're gonna move forward. And since COVID-19 is not over yet, we don't know what is in the future. We don't know in June and July, we again have to go slow down stop coming to work and then start wearing mask again. But we have some kind of a structure in place already. It was difficult in the beginning, of course, because we were like mostly on site. There are few members who were working remotely, trying to fix the time and trying to create the meeting. It was difficult, but like overall, like in maybe attending like 5,000 Zoom calls in last 2 years or more, we get used to with this thing. And of course, there is like a separation between the people on site. They think very differently, people who are working remotely, and it goes vice versa. But I think everybody is contributing. We could not reach where we are if not everyone have contributed. People working remotely, people coming to the work, and I signed up for this thing when I took this career choice, like maybe 15 years ago. I will be working in the lab with my team, and I was living that, but it was challenging, but I think we lived with, ultimately we started putting the classes also through remotely, hybrid system. And I think we are getting used to with this whole system. So I think it should work fine.
Great, thank you. And Annabelle, so you do tons of work in the community, as you shared in your introductory remarks, especially in communities that have been disproportionately impacted by the COVID pandemic. So what support or resources you believe are really necessary to ensure the success of public health professionals who interface with the community, folks like you? How can we be better prepared to respond to the next pandemic?
So thinking about our team, right, and as I shared, we were primarily working remotely at the start of the pandemic. However, we were forced and really unprepared as we were speaking with families to hear about all of the different social issues that were affecting them. So, we started asking questionnaires about COVID and other, and as you're asking questions about, have you had COVID? Have you been impacted by it? Have you, it elicits stories, right? And I feel like we're not social workers, right? We're researchers, we're scientists. And yet, in order to maintain a cohort, as our study does for over 20 years, you have to develop rapport, you have to develop trust. You have to get to know the families and really listen to what their needs are, as well as trying to get information. It's not just about us getting information for our research, it's sort of a give and take to establish that trust and keep them on. And I think that our team and our directors did a really good job of trying to support us through this. They understood that we were in a difficult situation where, we were kind of thrust into filling in the gaps. And I keep using that word, filling in the gaps. I'll tell you one story. We had a number of mental health issues and scares where family members sort of text our research workers to let them know that they were experiencing suicidal ideation. And our staff was sort of put in the role, despite not being necessarily equipped to handle those things, where we had to call and try to get a mobile crisis unit in there. And guess what? We referred to mobile crisis unit. It was a voicemail message. It said, leave a message after the tone. And we're like, no, this is like an emergency. This is right now. And, so we ended up having to stay on the phone for hours with this person, call an ambulance, and ultimately potentially saved a life, right? But that was a situation that we were ill-equipped to handle. And that's just one example. We've heard about everything from domestic violence to, losses of jobs to other impacts. And as we're trying to link our families with resources, we needed support ourselves, right? We're listening to all these stories. We have all of our own things going on as well. And so our team, we met, we actually had one of the psychologists that worked with the study meet with our team and talk to everyone and sort of just had a sharing and venting of ideas. And and received some resources from him and a list, and sort of came up with a manual of resources that we could use to refer our families as needed. And so as we think about the next pandemic and as we think about being prepared to address, we really have to just think about being creative, about finding ways to support our teams, not just with the resources that they're going to need to help the public, but also to support the staff themselves who are going to be dealing with some of these things. So mental health resources, I know that Columbia has the COPE program, they have all kinds of supports. So I think that doing a lot more of that and really linking staff with mental health supports, resources is going to be extremely. And I want to just say, I used the word resilience earlier because I hate describing our communities just as these communities that have all this need. I think that our communities are so strong. I come from Northern Manhattan, Washington Heights, and it bothers me sometimes, like, oh, communities, color and communities that are so disproportionately burdened. And yes, we are. Yes, there are all of these things happening, but there is so much resilience to these communities. And these research workers acknowledge that and see that. And that's part of the reason that we're able to work as well as we are with our families, that these families, despite all of these things that are happening in their lives, are able to move forward, to link, to get kids in college. We have, it's amazing the work that they're doing and how they're moving forth and continuing to engage in research and just thinking through, how they can make a difference. And so that's why they do what they're doing with us.
That's right.
So.
No, this is great. And as I'm listening to you and other panelists, I keep on hearing the importance of, building rapport and trust and communication and the professionalism and, all these soft skills, which I think sometimes we don't really emphasize. We're big on teaching our students the hard skills, right? But we certainly need to do more on the other end and teaching them the soft skills to go along with the hard skills to make them better able to connect with the communities that we want them to serve. All right, so I know that we have some students in the audience and many who are watching virtually who will be graduating in about 2 weeks. So I'd like to ask this final question. What advice would you give to our students who are about to graduate and enter the public health workforce during a pandemic? Terry?
Well, first I'm going to say something that I forgot to say earlier, which kind of follows up on how we can do better. One thing is obviously global vaccine equity, right? Intellectual property. Saw in HIV that people in the richer countries were able to live and people all around the world were dying because of access to medicine, access to treatment. And sadly, we saw a similar situation early on where we had the vaccine here and many, many other countries did not. So this whole issue of global equity and global governance of access to medicine needs to be fixed, to say it shortly. But so that actually leads me into the advice to students. I think this is a moment of tremendous opportunity. There is so much. The students are absolutely right. They're tired of hearing about disparities. They're tired of hearing about problems. They want to fix these systems and they absolutely need fixing. So I think, go out there and really try to make the changes that you are suggesting constantly. A lot of the critiques of public health are appropriate, but they require you to go out and push the boundaries and be excellent and be courageous and things can and will change. So I think there isn't a more exciting time to be graduating with this kind of degree because everything is in need of a reset. And I think we all know it.
Any others? Jessica?
I think building on, Terry, what you said about going out there to try and fix systems, I will say, keep asking questions, keep asking why is this done this way? And The counterpart of that is to realize that even though you are finishing your degree, you need to have a strategy for lifelong learning. You are going to need to figure out a way to keep up with the tsunami of information that's out there. I remember coming across the term infodemic in talking about all the information that was coming out about the pandemic. So, come up with a strategy that works for you, be prepared to adjust it, or that works well enough. Probably nothing works perfectly, so that you can keep getting fresh ideas, you can keep asking questions, and then you can in turn work on adjusting those systems.
Annabelle?
Thinking about, I totally agree that there isn't a better time right now. Public health is in the forefront. I think about making public health more visible, more tangible. We as public health professionals and students, you've learned all about, the impact that public health is making in prevention, in health promotion, in, systems, like clean water, et cetera. But in order to be successful, we have to, one, be great communicators, right? So to be able to take these concepts and make them real to the people that we're working with. We have to become more political. I know that sounds like science and politics don't mix, but we definitely have to be more creative about the way that we work with policy makers to help them understand why certain policies make sense. And we have to be political in telling them, you know what, this is the policy right now. As science changes, as we get more information, this may change. And we have to, I think that if you say that up front, and communicate sort of transparently, that yields trust, right? I think that was maybe a mistake early on to say, well, this is what we need to do. And you have to wear this kind of mask, and you have to say, this is what we know right now. And with the information that we have right now, this is what our recommendations are. As we learn more, things may change. And being upfront about that, I think that's important. So as students, I think that become a good communicator, become a politician. As a public health professional, you're gonna have to do it all.
Last but not least, Nishay.
Sure. I try to talk to my cousins or sometime other younger students. I did some high school symposium also during the pandemic time. I always try to tell them it's like a football game. Your strategy will change as the game proceeds. And ultimately we need to win. Virus is changing, so same as policies are changing. And we have to come up with some balance where we can get the most benefit of it. And like everybody said, there is not a better time to make a career or make a profession in the public health and biological sciences, because there's so much demand. We never thought the venture capitalists will be interested in this field. They are now. There's so much to do, policymaker, being leadership, be the change, work in the labs or work in creating the network. And it's a global disease, it's a global program. Doesn't matter where you can help. Either it could be in America, it could be some part of Asia, some part of Africa. Wherever you can contribute, because ultimately it's gonna be counted for.
That's great. And you mentioned, I like the analogy, you mentioned a football game. I always tell students, public health is not a spectator sport, right? You need to get involved. And what we're doing at Mailman is pouring in, the knowledge and the training that our students need in order to make a difference in our communities. So I would encourage our graduates to, this is a perfect time, stand up for what is right, fight all of these inequities that we're talking about, because you have what's in you. We're pouring it into you, now pour it into our communities. All right, so at this time, we have 2 mics in the front. So if you are willing, you can please come to the mic and ask a question of our panelists. We also have an opportunity for those watching virtually to ask a question. And I see a couple of them popping up here. While we wait for someone, a brave soul, to come and ask a question, I'll read one here. Panelists, it says, what advice do you have for junior scientists and students who are disheartened by the misalignment between the science for continued mitigation strategies and the political economy of back to normal. The evidence for testing, quarantine, et cetera, is strong, but the CDC and government agencies continue to cut back on them and are now defunding free testing programs for uninsured people. That was a mouthful. Anyone?
I think that goes to what we were saying.
Yeah, exactly.
That you
Been
have to,
saying.
that you have to just be able to adjust, like public health, as a public health professional, I think that you're gonna wear many hats, and one of them is inevitably gonna be fielding those questions and the mistrust and the political attacks on science. And you have to be able to do it in a way that really listens to what the concern is, you know, and somehow attempts to address it with facts, you know? What was it that you said? Not convincing or
Yeah, educate, not
educating? Exactly. Educating, not convincing.
Thank you. Dean Freed.
Thank you, Michael. This is a moment, of course, to start by thanking all 5 of you for your leadership and teamwork and resilience through this whole pandemic and all that you've accomplished. Thank you. And you've been huge contributors to us coming out the other end here. One of the things that we've learned in this pandemic over and over and over again is that the poor state of health of the population in the US really undermined or created huge risk for people. And so as we think about going forward and what the agendas are going forward, it raises the question about how we not only get reinvestment in our public health system and enterprise, but actually how perhaps it should be re-envisioned and reshaped to create a healthier population, to be more pandemic resistant, but also and resilient, but also for better health in general. So I'd be interested in each of your reflections and that of anybody in the audience about really what we want to put forward as the future of what we need to deliver to increase population health going forward, and what we've learned from this pandemic that could really inform a clear vision here.
So working like this whole like viral immunology and like public health and diseases, something like the strong idea I've been thinking for many years, which is like more stronger now. When we talk about like immunity and health, what you're asking, it's not a group trait. It's not like Colombia versus Cordell. It's not versus Spanish, non-Spanish, white or Black population or African or anything. It's more like very individual trait. We all have a very individual immune health. So we need to start considering individually and try to get some kind of data, try to get some kind of report of individual health. And then like right now we are facing this biggest challenges still like COVID-19 in immunocompromised patients. And we see the data coming every day, something new. 6 months ago, 1 year ago, Johnson & Johnson vaccine not very successful. From yesterday, there's a report in a very good journal, Johnson & Johnson produced better immune response in immunocompromised patient than Pfizer and Moderna. So as we are learning, we need to educate individual about their immune health and also the resources for them, how they can be safer. And in next pandemic, hopefully we like everyone living here will not see the next pandemic. If it happens, they should be more prepared and be consistently talking about like next pandemic. I just feel like they're still living in the COVID-19 pandemic. It's not going anywhere for next couple of years. And this next surge has happened or something, how they can be prepared with everyone have like their immune profile known. Like almost like million Americans are living with immunocompromised status, and the unknown population is 5 times more than that, which we don't know about it. So trying to get that information will be really critical for development of the new resources and also like how we're going to deal as a public health expert on those things.
So the United States has been, it's a wonderful place. But we have also been very focused on cure and medicine. And when I'm sick, I take this and I feel better. And so I think that a lot of the work that needs to happen is in sort of shifting the lens through which we view health, right? And so that's a big task. When we've been accustomed for many, many years and for the history of our country as viewing health as something you treat rather than prevent, I think it's a big ask. So obviously investment in prevention, investment in health promotion. And there has to be in some ways, and this is what I'm talking about, we have to wear many hats, sort of an information campaign. We have to put public health in people's faces, right? I think that heart transplant is in people's faces, right? You cure this disease is in people's faces. But when you talk about, I prevented this, that's not as easy to show. And so I think that that's where we need to do a lot of the work. And yes, I think that we have to just reimagine what health means as a country. And that's a hard case to make, but I think we can, so.
I've been reflecting on the fact that in the United States, we are close to reaching the very unfortunate milestone of 1 million deaths due to COVID. And 3/4 of those deaths occurred in people over the age of 60. And we also know that most of the deaths occurred among people who were not vaccinated. And so when I think about an agenda going forward, because I like to have simple, clear objectives, I would really suggest that we focus on vaccine preventable diseases and bolstering awareness of vaccines, not just for COVID, but for flu, for other, anything that we have a vaccine for, measles, and so on. I think pushing forward with wider uptake of vaccines among all the different segments of the population would be an important way to go forward.
So I think I agree with everything that was said, but we have a real problem with access to healthcare in the U.S. We have states that haven't expanded Medicaid. We have flip-flopping on funding streams for sexual and reproductive health services. We have the politicization of abortion. We have the highest maternal mortality rate of developing countries for Black women. So there's a lot going on here that is about justice, I think, and investment in public health infrastructure that will actually ensure equal access to healthcare. I think that, if you also look at the impact of COVID, you see that areas that have been plagued by environmental injustice were disproportionately affected, right? So we cannot not look at that certain communities have been overburdened by industry, by toxic facilities. Those same communities were disparately affected by COVID. So we have to start making connections. We have to start doing a lot more research on the environmental exposures driving maternal mortality, the environmental exposures driving all kinds of things. I know there's a lot of great work being done, but there could be so much more, including surveillance around all of these issues. So, we have a lot going on in communities, and somehow complexity has been used as a way to prevent really complex research from getting done, and that needs to be tackled.
And I would just say, this is such a great moment, as we heard from all of our panelists, where a bright spotlight continues to shine on public health. Just thinking forward, we really need to, in my opinion, excite and attract a younger population of students into the field of public health. There's a proliferation of undergraduate programs in public health, But I think we need to go younger. We need to go to the high schools, the middle schools, and the elementary schools and really just excite our students about public health and attract them and invite them to this wonderful field that we're so fortunate to be in, because these are the next generation of professionals who are going to be tackling the next pandemic. So we need to start early. All right, with that being said, I think we are at an end. So I just would like for everyone to thank our amazing panelists, please.